Good afternoon. I am Dr. Claudia Shafino. I am a dentist in Sanofi Medical Institute, and I will give a lecture about the gums and the impact that these generate into the system, specifically on the bloodstream, how we can diagnose it, treat it, or relate it in our health. Okay, we're going to start with general information of the gums. The gingiva is the part of the soft tissue facing the mouth. They surround the teeth and provide a seal around it. The gingival gums are tightly bound, surrounding the tooth, and provide a bond to the primary bone, which helps resisting the friction of food passing over them. The gingiva function is to cover the alveolar bone and surround the teeth. This is the only clinically visible component of the periosteum inside the mouth. Healthy gingiva is coral pink in color. The gingiva is divided anatomically into marginal, attached, and interdental areas. The gingival margin is the border around the gingiva surrounding to the body of the teeth. The top edge or crest of the gingiva that is surrounding the tooth. The marginal gingiva varies in width from 0.5 to 2 millimeters from the free gingival marginal crest to the attached gingiva. Has a more translucent appearance than the attached gingiva. The attached gingiva is continuous with the marginal gingiva. It is firm, elastic, and strongly bound to the underlying periosteum of alveolar bone. Certain levels of attached gingiva may be necessary for the stability of the root of the tooth. The interdental gingiva is the interproximal space below the area of tooth contact. The interdental papilla can be pyramidal and is resistant to masticatory forces. The interdental papilla are the extension of gingiva and generate the filling the spaces between neighboring teeth. Depending on the size of the tooth, the mass of the interdental papilla varies. For us to understand a lot of the gum problems, there are some terms that we need to know. First of all, dental plaque is a biofilm, usually a pale yellow color. This develops naturally on the teeth. Like any biofilm, dental plaque is formed by colonizing bacteria trying to attach themselves to the tooth's smooth surface. It has been speculated that plaque forms part of the defense system of the host of helping to prevent colonization of microorganisms, and this can be pathogenic. Plaque is a soft, sticky film that builds up on your teeth and contains millions of bacteria. The bacteria in plaque cause tooth decay and gum disease if they are not removed regularly through brushing and flossing. When you eat, the bacteria in plaque use the sugars in your food to produce acids to eat away at the tooth enamel. Repeated attacks cause the enamel to break down and eventually resulting in a cavity that could be a hole on the tooth surface. When this plaque is not being removed, then the tartar can be formed. The calculus or tartar is a form of harder dental plaque. It is caused by the continual accumulation of minerals from saliva on plaque on the teeth. The rough surfaces provides an ideal medium for additional plaque formation, affecting the health of the gums. Tartar as well is a deposit that forms when plaque hardens on the tooth. Individuals vary greatly in their susceptibility to tartar buildup. For many, these deposits build up faster with age. Tartar is easily noticeable because of its yellow or brown color on the teeth. When the plaque and the tartar is not being removed, then it forms what is called a periodontal pocket. The word pocket is the first word people usually hear from a dentist. This is when there is a problem with their gums. They may also hear loss of connective tissue attachment, which means the gums are pulling away from the teeth, creating a pocket. A pocket is just as it sounds, a space that forms between the tooth and the gum, and this is a good source that provides a secure place for bugs to hide. Bugs living in the bottom of the pocket are provided with a protective environment in which they can be growing and growing and growing. Normal gum conditions can be from 1 millimeter to 3 millimeters. When a periodontal pocket exceeds of 3 millimeters, this is when we start the problems. Regular brushing cannot effectively remove excess from the area. Dental intervention is necessary in order to thoroughly clean the area. If a periodontal deep pocket is not attended, could lead to a weakened tooth and lose the attachment fibers that hold teeth in place. Some periodontal pockets can be reversed by changing basics of oral hygiene habits. If the attachment fibers have been damaged as a result of a deepened gingival pocket, then the area is referred to as a periodontal pocket. These pockets are discovered during a dental examination when the area is probed. Since the gums in a pocket are extremely sensitive, the slightest amount of probing will produce inflammation and bleeding. This condition must be attended to immediately order to remove any bacteria that could cause any infection. Gingivitis gum problems can be divided on gingivitis and periodontitis. Gingivitis can be divided on initial, moderate, and severe, and when this is unattended, it can generate a periodontitis which can be initial, moderate, and severe. What's the difference between gingivitis and periodontitis? Well, gingivitis the meaning of that is gum inflammation. Usually precedes periodontitis, which means gum disease. However, it is important to know that not all gingivitis progresses to periodontitis. In the early stage of gingivitis, bacteria in plaque buildup can cause the gum to become inflamed and to easily bleed during toothbrushing. Although the gums may be irritated, the teeth are still firmly planted in their sockets. No irreversible bone or other tissue damage can occur at this stage. When gingivitis is left untreated, it can advance to periodontitis. In a person with periodontitis, the inner layer of the gum and bone pull away from the teeth and form pockets. These small spaces between teeth and gums collect debris and can become infected. The body's immune system fights the bacteria as the plaque spreads and grows below the gum line. Okay, gingivitis, it is a mild form of gum disease with inflammation of the gums. Gum disease is also known as periodontal disease. As gingivitis is usually very common, many people may have it and not know. Gingivitis should be treated because it can progress into serious gum disease. If a person's gums are red instead of pink, inflamed, swollen, and bleed when they brush their teeth, they mostly likely have gingivitis. Gingivitis is mainly caused by inadequate oral hygiene, not brushing your teeth enough or properly, and not flossing. Plaque, a sticky substance made up of bacteria, builds up in the teeth. The bacteria release the toxins that irritate the gums, and then the gums can start building tartar. They are bleeding easily, and this is when in general there is inflammation of the gum tissue. Most of us will have a mild case of gingivitis sometime during our lifetime. Gingivitis always starts off with a buildup of plaque, an invisible sticky film made up mostly of bacteria. When starches and sugars in food interacts with bacteria normally found in our mouths, plaque can be formed on our teeth. Brushing our teeth 3 times a day and flossing at least once a day removes the plaque. Plaque can reform very quickly within 24 hours of brushing your teeth. Plaque that remains in our mouths for longer than 2 or 3 days goes hard under the gum line and forms the tartar or the calculus. Tartar makes plaque much harder to brush away and acts as an environment in which bacteria can grow. This converts into gingivitis, which basically is the inflammation of the gums. Okay, periodontitis means inflammation, but that inflammation now is around the tooth. It is a serious gum inflammation that damages the soft tissue and bone that supports the tooth. All periodontal diseases, including periodontitis, are infections which affect the periodontum. The periodontum are the tissues around the tooth who supports it. With periodontitis, the alveolar bone around the teeth is slowly and progressively lost. Microorganisms such as bacteria glue to the surface of the tooth and multiply and generates inflammation. Untreated periodontitis will eventually result in tooth loss and may increase the risk of a stroke, a heart attack, and other health problems. Bacterial plaque, a sticky colorless membrane that develops over the surface of the teeth, is the most common cause of periodontal disease. So we can see on the pictures, on the photographs that are on the PowerPoint presentation, we can see the difference between a healthy gum versus a periodontitis and how this can be progressing if the gingivitis is not treated correctly. Periodontitis can be divided in early periodontitis, moderate periodontitis, and advanced periodontitis. The early periodontitis is the mildest from our periodontal infection. There is a slight loss of connective tissue attachment. This stage, the infection begins to destroy the bone and the tissue that supports the teeth. There is a sensation that something feels wrong, but it is mild enough to ignore. At this stage, brushing and flossing will no longer reach the base of the pockets, which in this case they might be 3 or 5 millimeters. The moderate periodontitis represents significant bone loss with the teeth beginning to loosen. As bone is lost, more of the tooth is exposed. The ability to arrest the infection becomes more difficult. The root dentin is no longer attached and the tooth may become sensitive. The pockets at this moment are between 6 and 8 millimeters. In advanced periodontitis, this is a devastating bone loss with loosening teeth. If no immediate attention is given, there is a high probability that teeth will become very loose and eventually fall down. Controlling the infection is a major challenge. Sometimes there are periods of significant pain and the pockets are over 8 millimeters. Okay. On the advanced periodontitis, we're able to find inflamed, swollen gums. Gums are bright red, sometimes purple. The gums hurt when they've been touched. Gums recede, making teeth look longer. Extra spaces appear between the teeth. Pus or suppuration may appear between the teeth and the gums. Bleeding when brushing the teeth. Bleeding when flossing. Metallic taste in the mouth. Halitosis, that means bad breath. The teeth are loose and the patient's bite feels different because the teeth do not feel the same. So this is when there is the starting of the bone destruction. It's not only the problem coming on the gum, the problem is coming more severe, and this is when the bone is receding and when we start losing teeth. This is when patients are saying, my teeth are falling by themselves and I don't know why. Okay, so we can check with the periodontal examination the grade of periodontal disease. On this picture, we're able to determine how deep are the periodontal pockets. On the left side, we are checking a healthy teeth which have a good attachment of the gum as well as the bone. Our millimeter pocket is between 0 to 3 millimeters. The gingivitis process is when there is a swollen gum. This is when starts the periodontal pocket, and when the periodontal pocket starts from 4 to 6 millimeters. The damage is only around the gums and not around the tooth. And when the gingivitis is not treated, then it becomes the moderate periodontitis, that it's the damaging of the tissues, destruction of the bone, and the periodontal pockets that appears from 7 millimeters to even 12 millimeters. When we have 12 millimeter pockets, this is when the tooth is only being held by a third of the bone. And this is when there is no good success on the treatment plan of these patients. This is a very good example of a patient with periodontal disease. As we are able to see, this is the upper part of the bone, and this is the lower part of the bone. And what I mentioned before is that the tooth needs to be close to the neck of the crown of the tooth, so the bone needs to be at this level. Okay, it needs to be at this level and on the neck of the crown of the tooth. When there is periodontitis, we see that the bone is on half of the area. It is around the root of the tooth, and this is when the bone is only holding the tooth on maybe on a third of the tooth. We can see on this lower right side that there is a very deep bone loss, and this is only being held by the tip of the root. That case was very severe. This is other example of a patient with periodontal disease. We are able to check again that the bone is receded. We have the bone up to this level, and for example, these two bicuspids on the upper right side, they are only being held by the tip of the root. Here on the lower left side, we're able to see a big shadow, and this shadow is a big infection around the bone and the roots of the tooth. So we're able to see that there is a big infection, and this is when the tooth needs to be extracted. This is another example of periodontal disease, and this is very localized. We are able to see these extensions on the root. This is the tartar that is accumulated between the roots here underneath the gums. Patient didn't even know that he had tartar, and when we show him, there was a big plaque of tartar around the teeth. This tooth was very loose, and there is a big infection right here. So just imagine the amount of bacteria that it's accumulated on the mouth, and how many times we are swallowing saliva into the system. So that means that there is a lot of bacteria that we are swallowing and that we are making or getting inside our body. Having periodontal problems make an impact on the health. Periodontal infections affect the rest of the body in different ways. Germs enter the bloodstream from infected gum tissue even by chewing. Conventional cleaning, such as flossing, water pick brushing, can open pathways from bacteria. There is a big connection from gum problems and systemic disease. Actually, a problem on the mouth needs to be considered as a problem on health as general. Like many areas of the body, the mouth is full of bacteria. Normally, the body's natural defenses and good oral health can keep this bacteria under control. However, without proper caution can reach levels that might lead to oral infections, such as tooth decay and gum disease. Also, some medications such as antihistaminics, painkillers, and diuretics can reduce saliva flow. The saliva is very important because this washes away food and neutralizes acids produced by bacteria in the mouth, helping to protect you from microbial invasion or overgrowth that might lead to disease. Studies also suggest that oral bacteria and inflammation associated with periodontitis can play a role in some diseases, and this can lower the body's resistance to infection, making oral health problems more severe. Periodontal disease or periodontal infections can be related to heart disease, diabetes, stroke, digestive problems, gastritis, colitis, osteoporosis, lung infections, and another autoimmune disorders. So it's very important to treat it because otherwise it can complicate other health problems. There is a big impact of periodontal infections on systemic disease. Every 4 of every 5 Americans suffer from gum disease, according to the National Institute of Dental and Craniofacial Research. Inflammation aspect is the key factor. The bloodstream links microorganisms in the mouth to the rest of the body. Bacteria from the mouth flood into the circulatory system and travel to other parts of the body, causing an inflammatory response. Other infections trigger immune system, producing inflammation elsewhere in the body. Okay. The mouth can be a major source of chronic release of toxic bacterial components in the bloodstream during chewing. Patients with diseased gums release significantly higher levels of bacteria. Now, physicians are making the link between medical factors and dental problems, not only hereditary and nutritional factors, which also those are infections origin. Heart problems and strokes are associated to fatty deposits that contains DNA remnants from a variety of periodontal microorganisms. Periodontal infections affects the rest of the body in different ways. Germs enter the bloodstream from infected gum tissue, what I said is even by chewing, conventional cleanings, also by flossing, brushing, can stay on the mouth with the bacteria. There are recent studies conclude that microorganisms were present in plaque inside the arteries, which plays role in the development of certain kind of heart disease. There are several medical articles that show the link between periodontal problems and heart conditions. Inflammatory process is the very beginning problem that we need to address. For example, this is an article that shows how the periodontal disease is affecting the systemic part of the body and how this affects the immune system. This is another study that shows that Gingivitis, that is the bacteria coming from the plaque, can be a very good pathway on the cardiomyoblast cells. So that means that there is a big connection between the bacteria coming from the plaque and the cells that are in the heart. There is also another study that shows that the two markers of the inflammatory activity, the C-reactive protein and fibrinogen, are associated with the development of arteriosclerosis and other chronic diseases. The reduction of C-reactive protein remained for 6 months. For example, here at Sanofi, we make a lot of precaution to study about the C-reactive protein and to make the link between the periodontal problems and the inflammation coming from other areas of the body. Several studies have been performed showing the following statistics. For example, there was a study from 9,760 patients that were studied, and those patients have periodontal infections. The result comes that 25% of these patients have a high risk to develop heart problems. Also, these patients are more commonly being men who were under 50 years old. There was another study about 9,962 adults in the age of 25 and 74 years old that have periodontal infection, and on those ones they show that there is a 200% of risk stroke. These are made by, this study have been made to African, American, and Caucasian people. Okay, the oral bacteria such as the Porphyromas gingivalis induce aggregation of platelets to the binding of specific surface protein. Gums bacteria cause oral bacterial products to enter the bloodstream and trigger the liver to make protein such as the C-reactive protein that inflame the arteries and promote blood clot formation. Patients patients that had heart attack that were survivors with periodontal infection also have greater risk of suffering a second heart attack. Also, these patients have tendency to have elevated blood cells of C-reactive protein and inflammatory protein, which is important on the periodontal infection. Bacterium Streptococcus sanguis, this is a common tooth plaque bacteria, cause human blood platelet cells to form clots. There is a study of injecting these on rabbits, and in 3 minutes of introducing the bacterium, the animal heart rate, breathing, and blood pressure increased dramatically. The EKG of rabbits revealed abnormal heartbeat patterns, and analysis showed that oxygen was inadequate on the heart muscle, similar as a heart attack, and this bacteria can remove quickly by the immune system, but when it's down, the risk is better. Okay. Patients with periodontal infection have increased level of blood clotting factors, which reach the cardiovascular disease. Bacteria from periodontal infections appear to have entered the blood and possibly stimulating the body to produce such factors as fibrinogen, which can cause blocked arteries. The fibrinogen can stimulate infections to produce high levels of clotting factors that generate a heart disease. This bacteria is one of the principal parts of clotting disorders, as well as some other factors like smoking, cholesterol, triglycerides, and obesity. Patients from 30 to 40 years old showed evidence of bone loss around teeth, were 50% more likely to have coronary heart problems. There are more than 300 species of bacteria alone that have been isolated from periodontal pockets, but only a few can cause periodontal destruction. Periodontal pockets and tissue have their own ecosystem. Gingivitis can encapsulate itself to resist defensive antibodies. As soon as these bugs have a protective shield, they start invading deeper into the pocket. Once settled in, they are very good at fortifying their position to have a better ongoing access to the host. When the inflammation is raging, it increases swelling and redness and allows the penetration of the bacteria and the toxins. These are the most common risk factors of heart infections, and periodontal disease. Smoking, cigarettes, poor nutrition, diabetes, and being male, unfortunately. Okay. As a conclusion, we can say that some researchers have suggested that gum disease may contribute to heart disease because bacteria from infected gums can dislodge, enter to the bloodstream, attach to the blood vessels, and increase clot formation. It has also been suggested that inflammation caused by gum disease may also trigger clot formation. Clots decrease blood flow to the heart, thereby causing an elevation in blood pressure and increasing the risk of a heart attack. So what we can do about treating the gum disease and preventing a heart problem? Well, first of all, prevention is the best medicine. Although gum disease seems to be associated with heart disease, more studies are needed before we can say with certainty that the relationship is. Research has not shown that treatment for one of these diseases will help control the other, but we do know that regular dental checkups, professional cleanings, and good oral hygiene practices can improve oral health, and that good oral health contribute to good overall health. While regular dental exams and cleanings are necessary to remove bacteria, plaque and tartar, and detect early signs of gum disease can play a major role in preventive gum disease. It's very important that you brush for 2 or 3 minutes 3 times a day your teeth along the gum line. Floss daily to remove plaque from places your toothbrushes can't reach. Use a mouth rinse to reduce plaque up to 20%. The type of mouthwashes that we recommend are the ones that don't have chemicals or alcohol. There are very, very good ones that have herbs, coenzyme Q10, folic acid, so all needs to be natural in a better way. Eat a healthy diet to provide essential nutrients such as vitamin A and C in particular. Avoid cigarettes and smokeless tobacco. Okay, why brush your teeth is very important. Brushing every day will help keep your teeth and gums healthy. Having a clean teeth also makes you look and feel better. Your breath is fresher, your smile is brighter, and your teeth feel smooth. And the most important part is that you will improve your overall health. When you have gingivitis or when you have the beginning of periodontitis, there is a type of treatment that is called non-surgical treatment. That non-surgical treatment is the debridement of the tooth and pocket areas using scaling instruments and disrupt gram-negative pathogen bacterial microflora to encourage a return of a gram-positive microflora conducive to health. So it's very important to go and check to your dentist, to have a periodontal charting, to check the periodontal pockets, and if you have tartar, and if you have several areas with plaque, several areas with tartar, it's very important to do scaling and root planning of the teeth. This is very important because removing the tartar and the plaque, we are removing the first step of the gingivitis. Then you have a healthy mouth, you can control it, and you can keep your mouth in good conditions. Unfortunately, when this stage is not being treated, then the tartar keeps accumulating over and over and over until the damage is now on the bone. Actually, periodontal disease can be called as the silent disease. At the beginning, this gives symptomatology, like I told, the swelling, the bleeding, and the soreness. Then, when this is not being treated, then it becomes without symptoms, patient said, I cure by itself, but this is when the problem becomes deeper, and this is when there is some problem on the bone, and there is when there are receding gums and bone. So that is very important to have prevention at first stage, and if it's necessary, the no surgical therapy. When there is a severe periodontal treatment, such as an advanced periodontitis, this is when the surgical treatment is recommended. Severe periodontal disease requires periodontist evaluation and in some cases periodontal surgery. This periodontal surgery consists on taking away part of the gum and then expose the root of the tooth and scrape continuously the bacteria and the tartar that could be on areas that we are not able to see. And then we suture the area, we close the area, and we wait. If in a couple of months or in 6 months there is an improvement, that means that there is a surgery with success. If by any chance this one doesn't have any improvement and the teeth stay the same without the bone grow, or if they are loose, or if they are having a high mobility, that this is when we decide, or the periodontist decide, to start extracting teeth and in order to eliminate the bacteria or the infection that could be on the apex of the root. Okay, so if you have a heart disease, it's very important that establish and maintain a healthy mouth. This means brushing and flossing daily and visiting your dentist regularly. Make sure your dentist know that you have a heart problem and share your complete medical history, including any medication you are currently taking. Carefully follow your physician's and dentist's instructions about health care, including using prescription medications such as antibiotic as directed. On most of the treatments for cardiopathic patients, it is very common that the dentist order a prophylactic antibiotic. This is very important to avoid any future infections, and if you're, that's why it's very important that you need to share with your dentist your clinical history, your clinical aspect, and if it's necessary, an antibiotic will help and avoid a future infection on other areas of the body. Okay, so this is the end of the webinar. This is time for questions and answers. If you want to, well, if you have some of them, so I will be able to answer them. I will read them here from the chat, and I'll be able to answer them. Thank you for hearing me, and I hope you find all this information helpful for you. Okay, there is a question here that this is, I've read that sesame oil mouthwash for 10-20 minutes daily before breakfast is recommended by ayurvedic medicine. I love to have. Well, sesame oil is a very good one. You can do it. What we recommend mostly is to take a good amount of coenzyme Q10, of folic acid, of vitamin E, as long as vitamin D. Okay, so it is very very helpful, all of these nutrients or all of these supplements in order to improve the oral health. Also, there are some mouthwash that have aloe vera, Also, those are very good. Sesame oil is also very good. Coenzyme Q10 mouthwashes are also very good. So those are very good products. The ones that we are trying to avoid are the ones that have alcohol or the ones that have chemicals. Yes, Hi, Dr. Claudia. Do you suggest oral rinse before or after brush and floss? Okay. What is the best is to brush your teeth. Most of the dentists are recommending to brush the teeth twice a day. So the best is to brush your teeth 3 times a day, on the morning, on the afternoon, and night. Okay? So it's very important that you brush your teeth very thoroughly. After that, floss, and then after that go with the oral rinse. Okay, after the oral rinse, if that one has herbs or any vitamins, the best is that you don't take any liquids or any food on the next 30 minutes. So that's the ideal part. It's very important the night brushing. This is one of the most important brushing about that. It says here, are there any safe mouthwash or rinse available? Okay, the ones that we recommend are from the brand BioPro. BioPro is a brand, and the name of the mouthwash is called PerioClear. That PerioClear, it's very, very, very good stuff. Actually, we use it here at Sanoviv. And that one has a bunch of herbs, and that one can be sold on a oral mouthwash and also a concentrated one if you want to use it on the reservoir of the water pick for you to rinse your periodontal pockets. But the brand, that brand is very good. BioPro, and the name is PerioClear of the mouthwash. The oral irrigator is the PerioScript, and you can put it on the reservoir of your water pick. There is another option, but unfortunately you need to buy a machine. There is a machine that generates ozone. If you generate water with ozone, it will be very helpful for you to rinse or for you to clean your mouth. And that machine is a little bit expensive, and you need to generate your own water. But if you are just looking for a mouth rinse, the PerioClear is a very good option for you. Okay, it says here, if you have periodontal disease, how can your heart be tested for disease as a result of it? Well, you need to do an EKG. If you have a periodontal disease or if you have constant gingivitis process, the best option is that you do some laboratory testing, and then after that try to do an EKG. Sometimes you can have the periodontal disease with gingivitis and gingivitis with periodontal disease. Sometimes there is patients with periodontitis don't have heart problems, but there is a big risk. And it's very important that you correlate or do your medical evaluations along with the periodontal evaluations. This is very, very, very important. Okay. It says, I have a tooth to be extracted. How long will it be before I have a bridge in place? Okay. When you extract teeth, it is very important to wait at least 2 or 3 months. The gum will heal in the next 7 to 10 days. But it is very important to check that the bone is healed completely. So that can be done on the next 2 or 3 months. So it is important that you do an X-ray to see that the bone is healed completely, and then there is a good time for doing a fixed bridge or a removable bridge, whatever you decide. What do you think of brushing with coconut oil? Well, I'm not very familiar with that, and I'm more familiar with toothpaste with coconut oil. So it is very important to use a toothpaste that has a component of that. Actually, Usana has a toothpaste that is very, very good. That one has a lot of supplementation as long as the aloe vera, and is very good. If coconut oil is helping for you, then it's a good option. I don't have so much experience of that, but I prefer a toothpaste that it's a mix of some other stuff and herbs and supplementation. What is a natural homemade mouthwash you will suggest? Well, I already said that the name is Perioclear. The name is Perioclear, and that's the mouthwash. I'm gonna write it. And the brand is BioPro. Okay, what is how does fluoride or fluoride-free toothpaste affect or influence gingivitis? Well, the best is to use a toothpaste without fluoride. Okay, fluoride, it is a chemical, and that's also a toxic material into the system. It is no necessary extra fluoride on the toothpaste because we already have the fluoride on the water, and we have the fluoride from other vegetables coming there. Okay, so the fluoride doesn't improve the gum conditions, and can be affecting more the health of the person. Can I use a few drops of iodine on the toothbrush as a mouthwash, which I can then swallow for my health? Well, iodine is not making any bad part on your health. So, well, there is no contradiction about that. What I maybe suggested the best is to take some cell salts. Cell salts are extracts from the minerals that help to rebuild the gum and the bone. And there are two cell salts that are very good for the gums. One is the Calcarea fluorica, and the other one is the Calcarea phosphorica. We recommend to take them for at least 3 months in order to see some improvement on the gums. Okay, is it okay to mix Perioclear with another for taste and breath fresher? I don't recommend it. The Perioclear is very concentrated. That is a concentrated mint flavor, and we don't need too much to rinse our mouth. So I don't suggest. Actually, the company says that you don't even mix it with water. Okay, so I'll suggest to take it as the instructions are saying. Could stomach diarrhea come from oral health issues? If so, what do you recommend? I'm otherwise quite healthy. Okay, yes, stomach problems can be related to periodontal problems. Is because there is a big source of bacteria on the plaque and on the tartar. So that plaque and tartar are stuck on your mouth, and when you are swallowing, then thousands of bacteria are coming through your digestive tract. So when you are making the digestion, the stomach is working with the acids and bacteria, and that can generate gastritis, colitis, stomach ulcers. Could be having some diarrhea and some leaky gut. So what I recommend is to go to the dentist, do a deep dental cleaning, scaling root planning, eliminate all the bacteria that you can from the mouth, and as well going to the physician to have a good evaluation of the stomach. Maybe also something that you are eating is affecting your body. Thank you. What is the brand? The brand is BioPro. It's let me write it. It's BioPro. The brand is BioPro. The name is PerioClear. What is the machine that generates water with ozone? That's an ozonated machine. That you can look on the internet. You can look at ozone machine, and there could be several brands of that, and that is a machine that is very helpful. For example, we have it. We treat gums with ozone with very good results. Okay, any foods or beverages to avoid? Well, junk food or sodas, wine, that also affects if you even if you are not brushing your teeth right after that. Those are the ones that you need to avoid. Will this webinar be able to watch later? Thanks again. I think so. I think they're gonna record that for the YouTube. I think you can find it there. Okay, what about using coconut oil for swishing around in your mouth? Heard this is disinfect, it's antibacterial, just heard about it. Coconut oil, it's a good stuff. It's a good stuff. It has a lot of properties from some other things, and you can do it as long as you are cleaning your teeth and as long as you don't have tartar on your mouth. Any oil, any mouthwash is not going to disintegrate the tartar or the plaque. That's something that you need to work on it and your dentist. Okay, so if you have healthy gums, then you can do the oiling and all that. Okay, what salt can you write, please? Okay, cell salts, and that's I'm writing, okay? Calcarea florica and calcarea phosphorica. Okay, the name of the cell salts are calcarea florica and calcarea phosphorica. Okay, you need to take them for 3 months. Okay, so I already wrote it. Is it helpful to use organic oregano oil, few drops in glass of water to kill? That's fine. Oregano is also a good source of that. Once again, you need to have your mouth healthy, without plaque, without tartar, and you can do the mouthwash as well. Okay. Mercury filling removal, do we need to detox? Yes. If you remove mercury fillings, it's very important to have detoxification. How does periodontal disease affect fetus? That's the same thing. The bacteria is on the bloodstream, okay, and when the bloodstream comes all over the mouth, it gets the bacteria that are on the mouth and it keeps going on the bloodstream. So the blood is on the arteries, they are coming into the whole body and it's coming through the fetus as well. Actually, on pregnant woman is very important to monitor the gums, because about the hormones, there is a big tendency of develop gingivitis during pregnancy. That's why the cleanings are very important at that level, and brushing very well is very important. I had an implant screw put in, but there was a lot of heavy banging with a metal hammer, which reverted my head, and the tip went into my sinus. Well, I cannot answer that question. It is very important to check the x-ray. Some of the implants can be affecting the sinus at some point, but it's very important for you to go to the dentist to have an x-ray and evaluate it. Okay, thank you. Do you know where I can find a list of dentists not using fluoride or amalgams in Mexico City? Well, I don't know, but you can look for, there is a web page that it's called mercuryfreenow.com. And right there is a link that says find a mercury-free dentist. And at that part, you will be able to find some dentists nearby your home. Okay. Why should we avoid alcohol in mouth rinse? Because that they tend to irritate the gums. The alcohol is maybe to feel fresh, but they tend to inflame or irritate the gums. And sometimes the scope or the Listerine, they just give like a big flavor of mint, and these are not cleaning or killing any bacteria. So that's why it's very important to avoid alcohol and substitute that with some herbs or with some supplementation on the mouthwash. What can I ask my dentist to use instead of fluoride? Well, normal, regular dental cleanings. There is no need for extra fluoride, not even on kids. Okay, so you don't need to ask for something instead of fluoride. What type of detox should be doing amalgam removal? That's a very extended answer. You need to visit a dentist and a physician, have some laboratories to see how much mercury or how much detoxification you need, and based on that, they can give you a detoxification program. This has been very helpful. Is there any specific that we should do prior amalgam removal? It's very important to clean the gums. Very, very important to clean the gums. It's the same thing as a house. When we are buying a house or when we are getting into the house, we prefer to clean the floor, the windows, the walls, everything before putting a new furniture. It's the same thing with on the mouth. It is very important to clean the environment. It's very important to clean the gums, eliminate inflammation in the periodontal pockets before changing or replacing any restorations, and more on areas where you need to put crowns. The gum takes priority over mercury fillings removed or over crowns. So when you have good gum conditions, then it is time to work on the amalgams. Okay. Thank you. What kind of doctor does the detox? Any could be a holistic doctor or a doctor who is trained on the functional medicine. That could be a good physician. Or if you want to have everything set up, you can come here to Sanoviv. Sanoviv is a very nice place where we have, it is a facility where we have all the practitioners. We have physicians, dentists, psychologists, nutritionists, chiropractors. So even when we remove when we recommend removing mercury fillings, there is a program that is the amalgam removal program, or patients can join another program and remove the mercury fillings with the correct detoxification. So that's why every program is tailored, and because not all patients require detoxification as strong as others. It's amazing information. We don't bleach teeth. We don't recommend the bleaching because of the chemicals that are being used on that. What we mainly recommend is the oral technique, the brushing technique, and try to avoid coffee, avoid wine, or it's very important to brush the teeth right after you have a meal. Is there a website to find a functional medicine doctor that you would recommend? I really don't know about doctors. Maybe you can look on the internet. The doctors that I can recommend are the doctors that are here in Sanoviv. They are amazing. They are being trained on functional medicine. If you want to to have more options, you can call to the admissions department. So maybe you will be willing to join a physical evaluation or a medical program and to have more information. Okay. Okay, so there are no more questions. Okay, so well, there is one more. Did you say we should brush then floss? I want instructor to floss first. Okay. Each criteria, it depends on the different dentists. The way we recommend is to brush your teeth, then floss because you remove the excess of what you already brushed, and then the mouthwash at the end to remove what it's brushed, what it's flossed, and then to rinse the mouth. Okay. My son did not have bleaching, but these teeth look really weird. Could that have been the fluoride treatment? Well, I'm not sure about what they did to your children. Okay, but we don't recommend whitening. If there is some stains on the teeth, that could be up to fluoride. Because fluoride tend to stain the enamel of the teeth. It could be good if you go to your dentist and clinically evaluate those teeth. So that's the best option. I cannot answer that because I haven't seen the case. Okay, so thank you very much. Thank you very much. Okay, for a very informative webpage. Take care. Thank you very much. Good night. Okay, so thank you very much. Thank you very much for all your input. I hope you enjoyed this lecture as I am. So if you want more information, it's very important to contact your dentist to have general evaluations, and don't forget to brush your teeth, to floss, and take good care of your mouth, because also it may have a good impact on your system. Okay. All right. So thank you very much, and I hope you have a good night. Bye bye.